looking at beyond GDP, putting purpose into the UK Trade and Investment Partnership. So first up, I am delighted to welcome to the stage, we have Harjinder Kang come on down, His Majesty's Trade Commissioner for South Asia and Deputy High Commissioner for Western India. Thank you very much. You can take a seat just here. And also delighted to welcome to the stage Sharvil Patel, MD, Zydus Cadilla. Welcome to the stage. Have a seat. Nice to see you. How are you? So we'll stop for a moment, take a quick picture. Thank you. So, Harjinder, I have co-opted you into being my co-host here on stage. I threw that one at you yesterday on the phone. Did you like that? Good, excellent. Well, but I think it's really important because you've just come out of a former job as the UK Chief Trade Negotiator. Before we bring Sharvil in here, I wonder if you could just reflect on what you heard from the Shadow Trade Secretary and give us a sense of where we are.
Yes, it was wonderful to hear what Nick had to say, because I think if there's one thing that is very helpful to understand and that is continuity. That if we manage to finalise the deal in a timely manner, say by the end of the year, all good. But if we don't, then at least there's continuity in the process, and that if there is a change of government, they have commitments towards this free trade agreement. The last 2 years have told us everything we need to know, that this is not a short-term thing that we're trying to negotiate. It's a mid to long-term trading relationship between two nations, and it can't sort of be done. They normally take years, and we're doing these at a pretty rapid rate of knots, primarily in order to take advantage of all the things you've just heard in terms of the market that is India, that is coming of its age, and now it's outward-looking and wants to sort of partner with like-minded nations such as the UK, and we're here to help forge that relationship.
Might get into this later, but the truth is that there's a sort of block, and it needs to be broken by the prime ministers. Am I right in thinking that?
Well, with all these negotiations, there are certain things that can be done at the official level, let's say. And they are the pieces of the jigsaw pie, the puzzle that you put together at a rate of knots. Then there comes things which are primarily red lines. Certainly my mandate has red lines within it, which, you can do these things, but you can't do these things. And some of those things are of importance to the other country. And vice versa, it's the same with India. There are things that they cannot do or won't do because either politically it doesn't work or the stakeholder opposition is too great. But if the deal is big enough and the prize is good enough, then the political leaders then have to make those calls.
Okay. Well, let's talk about pharmaceuticals, because it's already been an incredible partnership between the UK and India. Sharvil Patel, MD, Zydus Cadilla. Tell us about your company, first of all.
So I think for us as Zydus or any other good Indian pharmaceutical company, what we have fundamentally worked over the last 3-4 decades is on access and affordability, is to provide high quality medicines post-genericization. And I think a large part of what we do is to reduce the overall healthcare burden for any of the developed countries by providing an alternative post-patent expiry. So I think that's been the most critical aspect of what we've been able to do. Again, when we talk about access and affordability, whether it is global vaccination, and India has played a pivotal role in that, or it is now transforming itself towards, and Zydus also is transforming itself to providing for future needs where we can matter, which is like rare diseases, orphan diseases. These are mostly neglected by the large companies many times. And for companies like us, it makes it a lot more important that we can make an impact by working on some of these areas. So these are exciting times, and that's what we are sort of building towards.
So I'd love to hear a little bit more about what you'd like for a UK India free trade deal, and I'm going to have Harjinder jump in with any questions he has, but what would you like to hear? What would you like to see in one?
So I think, as I said, today, I would say whether it is UK, US, all the developed countries, about 40 to 60% of what is prescribed or dispensed at the pharmacy is produced in India. So it is a very integral relationship. It's not a goods and services relationship which is good to have, it is a must to have. So I think anything that we can do to improve the regulatory hurdles that exist, the reciprocity or cooperation on the regulatory side to have a capability where we all can work together to get faster approvals, faster to market. Supply chain has been a very critical aspect in COVID, and we are very proud to say that India, being such an important manufacturer, did its duty in terms of providing access to these medicines in spite of borders being shut, vessels not being available. So I think going forward, the most important thing is to allow for access of generics in UK in a larger way. And that becomes more important because if you look at the future, today the top 10 selling drugs in the US or anywhere in the world are biologicals. If you look at UK, even the NHS will not reimburse some medicines because just way too expensive. So I think over a period of time, even that will be an important burden on the healthcare system which can be reduced, provided we have a better regulatory framework like a generics framework for biologicals. I think going forward, the most other important area is the data that India is generating with the onset of ABDM that we have set up and the universal health stack and the universal interface that the country decided to do. So I think if it goes the UPI way, which is on payment system, this would be transformative. And I think between UK and India, there could be a great opportunity to build this alliance on data. Because FTAs are not always about goods and services, which everybody looks at. But I think the wealth of capability that India will create with the universal healthcare and universal health systems would be, I think, beneficial for both countries.
I want to come in on that, Harjinder.
I do. I mean, there's some very important points you've raised, and I'm glad you have. You're right. This FTA is not just about goods, services, and investment, which is typically what everybody expects from a free trade agreement. In order to be a long-term relationship, there are many other aspects of our ways of doing business that we need to accommodate in the FTA. And you've touched on a couple of those, and certainly intellectual property rights has been a huge debate, both here and in India, along with the stakeholder bases on both sides. Effectively, there are global standards when it comes to IP, and effectively India has an opportunity to start to, let's say, put those in place in terms of what they could be recognized. If it was a multinational pharmaceutical company looking to invest in India, they would know that their sort of patents would be respected and could, more importantly, could be enforced. And that's something which I think when you talk to most of the sort of multinational pharmaceutical base, they have experienced issues with. Having said that, I totally agree the access issue is something which has had to be respected. Patents have a predefined life, at which point generics come into the market and allow greater access. And that model has been there for decades and seems to get the balance right between rewarding innovation but creating access for the whole planet. I mentioned to you that I actually had a career prior to this, which was with AstraZeneca for 30 odd years. And so the industry tries to get that balance right too. So that's one aspect. The other you mentioned was regulatory processes in play, and could they not be speeded up? The MHRA, the UK's regulator, has a pretty predefined way of approving a new medicine. And days are listed in terms of when you apply and when you will get a license. It's pretty standard and has been for years. So as a process, it is one of the gold standards of the world, let's put it that way. That's not to say we can't look at other ways of doing things. And certainly there's been discussion around mutual recognition of others, and would that be something that the UK would be willing to entertain? that's one for the MHRA to consider, and we'll see what the outcome of that discussion is at some point.
Two other things I wanted to talk on, and one was about this idea of the rare diseases, because this is one of the areas where I think technology and where pharmaceuticals can really come together. Small areas of manufacturing where the population who needs the medicine for a rare disease is small. I'd love you to say a little bit more about the prospect for what Zydus can do in this, and what a UK-India partnership on this might look like.
So today there are more than 40,000 diseases where I think there have been no treatments available. These are, again, as you said, affecting a very small subset of patients. So the biggest challenge first is to find these patients and have the right diagnostics, early screening and all of that to make sure that we identify people early so that they can be treated, and then find a treatment solution. So I think the challenges with these is that it's not only about discovering a molecule, it's also about identifying the patient, which is the second difficult part also. So I think I can just give you an example. We have one medicine which is for newborn diseases, which is for a molybdenum cofactor A deficiency, where we are the owners of that product. The hardest thing is to first identify these patients, and if they don't get it in the first couple of years, there's a chance of morbidity and death. So I think it's going to become very important to build a relationship, and UK can do a brilliant role with India in terms of working, partnering, sponsoring these kind of development activities, because it is important to take care of all people, and these generally affect very young children. So I think it's even more impactful when we are able to do something around here. So whether it is a copper histidine deficiency, whether it's this, there are so many diseases which are untreated today. And with the advent of AI, with premier institutes in UK, I think there are some kind of these partnerships that already exist between UK and the All India Institute of Medical Science, or the Tata, the Wellcome Trust, and other partnerships in India. I think more of these can be formed at the education, university levels, academia, to work on these, because big pharma are never going to, or mostly are never going to be working on these areas. So it offers a great opportunity to create impact. And that's why we decided to do something. It may be not a financially big opportunity, but from the social and fabric of impact, it is a very meaningful one.
Thank you so much for sharing that. I wanted to ask you about the STAC, the United Health interface. I'm being told we have to move on, so we might have to come back to that a little bit later today. But thank you very much for your time. We'll keep you, Harjinder, here. We'll allow you to go, get on with your day. Thank you so much. Lovely to see you.
Lovely to see you.